Hi guys, we have a case of perforated appendicitis. In this case, I'll take it as someone comes into the ED with abdominal pain and I don't know what's going on. So again, in the beginning, I always like to look at a case as if just spend 15-20 seconds, go through the entire CT, see if any area catches my eye, and then I focus on that area. And it's only after that that I follow my source pattern. So let's start with the lung basis. I didn't see a big pleural effusion, pneumothorax, pulmonary consolidation. Let's go down into the abdomen. And I'm just taking a quick peek. So quick peek at the liver looks okay, spleen looks okay, gallbladder looks okay, pancreas looks okay. I go down to the kidney. I didn't see a hydronephrosis. This person has tiny renal stones. And let's go down, and right now there's this lobulated collection I see with inflammatory fatty stranding. And as I go down more, it's centered more on the right side of the abdomen. Looks like an abscess. I go down more. I didn't see any ascites. Come up here on this side. I didn't see any ascites. So the thing that catches my eye is right there. So in the right lower quadrant, I have this multi-lobulated collection. So the first thing that comes to my mind is that could it be related to Crohn's abscess or appendicitis with abscess? Less likely would be, could be some kind of metastasis. But that I would have to see other evidence of cancer in the abdomen or pelvis or somewhere else. So let me try to come up here. So again, I told in my previous video that most lateral and posterior part, you're going to see the ascending and the descending colon. So let's follow my descending colon down. Here's the terminal ileum coming out. And the wall of the terminal ileum may be a little bit thick, but sometimes when there's inflammation close by, you just have reactive wall thickening. So the terminal ileum from here onwards looks pretty normal. So could there be, Crohn's disease that has only affected this part of the terminal ileum that caused the abscess? I guess that is possible, but let's try to find my appendix now. So I'm coming down. From here, I have appendix come out, and appendix goes out to here. And after that, I didn't see it. And even the proximal part of the appendix is slightly, it's more dilated than it should be. And there is inflammatory fatty stranding around here. And the appendix leads to this collection. So this makes me think that this is much more likely a appendicitis with periappendiceal abscess rather than Crohn's disease with an abscess. I think the terminal ileum is just reactive wall thickening. Let me go down. Now at this point, I would look at the vessels just to make sure there's no thrombosed mesenteric vein. So it started portal vein, left, right portal vein, come down here, superior mesenteric vein, inferior mesenteric vein comes out from near the confluence of the splenic and superior mesenteric vein, that's the inferior mesenteric vein, splenic vein, follow it out, superior mesenteric vein, let me follow it more distally. So this branch that going out here, this branch coming out here, it looks pretty patent. Inferior mesenteric vein looks pretty patent to me too. These branches, looked at the splenic vein already. Now the other thing is that let's look if there's free air in the abdomen or pelvis. Let me put it into long window and scrolling up. I didn't see any locules of air around here. That's just air in the terminal ileum. Going up, nothing, nothing, nothing. So at this point, I'll just follow my source pattern, but the diagnosis in this case is a appendicitis with periappendiceal abscess, and it's pretty big in size, especially if you look at the coronal, we can appreciate how big it is. Thanks for watching the video.